Up to 40% of people with AFib have already had a stroke, and they don't know it. No symptoms, no ER visit, just silence. And if you have AFib, this could be happening to you right now. I'm Dr. Yasser Rodriguez. Here's what a silent stroke is and how to catch it early. Most AFib patients are told to watch for one thing, a major stroke. Facial drooping, arm weakness, slurred speech, and yes, AFib raises that risk 4 to 5 times. But a landmark review in the Journal of American College of Cardiology called that only the tip of the iceberg. Beneath the surface, there's a second, far more common form of brain damage happening quietly, in real time. It's called silent cerebral infarction. Think of it this way. A major stroke is the part of the iceberg you can see. Silent strokes are everything below the waterline, and that's where most of the damage is. A meta-analysis of over 5,300 patients in the Annals of Internal Medicine found that AFib patients are 2.6 times more likely to have these silent brain injuries. They show up in about 40% of AFib patients on MRI. That's nearly 1 in 2 people sitting in your cardiologist's waiting room. Here's the word I want you to really hear: silent. These infarcts don't announce themselves. No alarm, no ambulance, no moment you can point to and say, that's when it happened. Instead, the warning signs get written off as normal aging, thinking more slowly than you used to, walking into a room and forgetting why, struggling to find words in a conversation, feeling foggy, unfocused, unmotivated, balance that isn't quite what it once was. Sound familiar? The ARIC study found that cognitive decline in AFib patients occurred only in those with subclinical brain infarcts. And the REGARD study, over 27,000 people found that 28.6% of AFib patients reported stroke-like symptoms: sudden numbness, brief vision changes, a flash of confusion, without ever receiving a stroke diagnosis. They call these whispering strokes. And here's the critical part. That risk was significantly elevated in patients not on anticoagulants. But it was not elevated in those who were properly treated. That single finding should stop every AFib patient in their track. So why does AFib do this? Think of your heart as a pump. When AFib disrupts its rhythm, it doesn't just affect your heart, it affects everything downstream. And there are 4 key pathways. 1, microembolism. When your heart quivers instead of beats, tiny clots form, often in the left atrial appendage, and shoot upstream into the brain. Too small to cause a dramatic stroke, but large enough to leave permanent scars. 2, chronic hypoperfusion. AFib reduces your heart's output. Less output means less blood to your brain. And this type of damage does not respond to anticoagulation alone. 3, cerebral microinfarcts. So small, they're invisible on standard brain scans, but they accumulate, and they're independently linked to cognitive decline. 4, systemic inflammation. AFib creates a chronic inflammatory state. Biomarkers like NT-proBNP, GDF-15, and IL-6 have all been linked to new brain infarcts in AFib patients. This isn't one problem, it's 4 simultaneous threats working against your brain quietly every single day. Here's where I have to be direct with you. The Orbit AF registry found that 23% of AFib outpatients were not on anticoagulant. And of those untreated patients, 84% had a stroke risk that was high enough to warrant treatment. More recent data from nearly 4.9 million AFib patients published in JACC Advances in 2024 found that nearly 30% were still not receiving anticoagulation. This is a crisis that's simply hiding in plain sight, and the evidence for treatment is now stronger than ever. The Artesia trial, published in the New England Journal of Medicine in 2024, studied patients with subclinical AFib. Episodes as short as 6 minutes. The result? Apixaban reduced stroke and systemic embolism by 37% and reduced disabling or fatal stroke by 49%. A combined meta-analysis of Artesia and the NOAA AF-NET 6 over 6,500 patients confirmed a 32% reduction in ischemic stroke with blood thinners. As lead researcher Dr. Healy of McMaster University stated, the risk of disabling or fatal stroke was lowered by 49%. Now, and this is important, anticoagulation is not a perfect shield. The Swiss AF's cohort study found that 85% of new silent brain infarcts occurred in patients already on anticoagulation. Blood thinners reduce the risk dramatically, but they don't eliminate it. This is why the 2023 ACC guidelines now recommend prolonged cardiac monitoring after unexplained strokes, because 25 to 30% of ischemic strokes remain cryptogenic. Many are linked to undetected AFib, and emerging evidence on rhythm control, particularly catheter ablation, is showing real promise. A meta-analysis of 14 studies, nearly 200,000 AFib patients, found rhythm control was associated with 26% lower risk of dementia. Ablation specifically, a 38% reduction. A randomized trial showed AFib patients after catheter ablation had measurable improvements in cognitive scores at 12 months compared to medication therapy alone. And the science is moving fast. So, what do you do with all of this? Here's your practical protocol. Bring this to your next appointment. Step 1. Ask your doctor about your CHADS VAS score. If it's 2 or higher, guidelines do recommend treatment. If you're not on a blood thinner, ask why. Step 2. Report subtle cognitive symptoms. Memory slowness, word finding, brain fog. Don't chalk it up to age. Ask for a MoCA screening. It's more sensitive than standard memory tests for catching this type of brain injury early. Step 3. Report transient neurological symptoms. Brief numbness, vision changes, sudden confusion, dizziness. Even if it passes in minutes, tell your doctor. It's very important. These may be whispering strokes. And step 4. Ask about extended cardiac monitoring. The 2024 ACC expert consensus is clear. The longer you monitor, the more often AFib is detected. Step 5. Discuss rhythm control options. If ablation hasn't come up, bring it up. The cognitive protection data is too significant to ignore. If you've been living with AFib and none of this has come up in your appointments, you're not alone. This is one of the most under-recognized threats in all of cardiology. But here's what I want you to take away today. You are not powerless. The research is clear, the tools exist, and the treatments work. And now you know what questions to ask. Share this video with someone you love who has AFib, or anyone over 60 who's been told that their memory is just getting older. And go to fightafib.com to download your free AFib patient guide and sign up for our newsletter. In our next video, we're going to look at whether catheter ablation can actually protect your brain, and the new trial that's changing how cardiologists think about rhythm control. I'm Dr. Yasser Rodriguez. Take care of your heart and your brain.